Assalamu alaikum and hi to everyone. This is Dr. Juveria Jabeen. I am pursuing my MD in General Medicine from National Research Institute of Unani Medicine for Skin Disorders, Hyderabad. Today I am going to discuss a topic on skin disorders, which is the most challenging one, that is psoriasis. I think everyone heard or know about this disease as a skin disorder with itching and scaling, but today I am going to give you a detailed concept and its management in Unani system of medicine. So let's start. Here I am going to show you some slides. Here we go with the first slide. First we will discuss the definitions. Psoriasis. It is a chronic autoimmune and non-communicable inflammatory disease of skin and joints with well-defined erythematous papules and plaques which are surmounted with large loose silvery scales. Whereas in Unani, it is called as the Khashiral Jild and described as dryness, roughness, thickness of skin and formation of irregular plaques which are associated with severe itching and round scales, the scales like that of fish. Next is the epidemiology. There is a worldwide prevalence of 2% with a higher prevalence of about 4% in the developed countries. Male and females are equally affected. Coming to the genetic epidemiology and role of heredity, there is a genetic link. Studies have proven that there is a positive family history in 1/3 of the sufferers. If one parent is involved, there is 10 to 25% of the chance, and if both parents are involved, there are 50 to 60% of the chance of getting psoriasis. Now coming to the precipitating factors. Precipitating factors or the risk factors like excessive intake of alcohol, unhygienic habits, stress, drugs like antimalarial, beta blockers, NSAIDs, tetracyclines, etc. Excess use of cold and dry food, zoophagosoma, that is indigestion, and yabusat wa khushunat jild, that is excessive redness of the skin, may be the risk factors for psoriasis. Coming to its etiology. Etiology of this chronic disease is not clear. Stress is the most common etiological factor, and patients with chronic disorders like Crohn's disease are more likely to suffer from psoriasis. And also drugs like that appear to have a strong causal relationship to psoriasis are beta blockers, lithium, synthetic antimalarials, and the non-steroidal anti-inflammatory drugs, that is NSAIDs and tetracyclines. And also patients with severe form of this disease have an increased risk of cardiac comorbidities. Coming to the Unani etiology, the causes may be mirrah soda, ghaliz khilte soda, balgam mishor, balgam imale, ghaliz mutafin zujaji balgam, and safra muhtariqa. These all are the abnormal humors of the body which leads to psoriasis. Next is the pathogenesis of this disease. The pathophysiology of this chronic inflammatory disease is mostly unclear, but it is seen that dendritic cells or antigen-presenting cells, APCs, sense the stress signals generated by the keratinocytes when antigen comes in contact with them. This further activates the naive T cells, resulting in the secretion of various cytokines that allows the further differentiation of naive T cells into effector cells like Th1, Th2, and Th17. Now, each differentiated effector cell secretes cytokines like interferon A, human necrosis factor TNFA, and interleukin 2. The differentiation of naive T cells into Th1 and Th17 cells depends on the presence of two different cytokines. Here you can see that is IL-12 and IL-23 respectively. And these Th1 cells facilitate the secretion of TNFA, IFNA, and interleukin 2. These in turn activate the APC to secrete more signals and activate more T cells. Th17 cells secrete interleukin 17, which is a prime cytokine in the pathogenesis of psoriasis, and interleukin 23 promotes the expression of interleukin 17A, interleukin 17F, and interleukin 22 by Th17 cells. Now, this TNF-A binds to its receptor on keratinocyte that activates the hyperproliferation, resulting in the development of lesion. It also activates the numerous cytokines and adhesion molecules involved in these inflammatory response. Now, recent reports from inflammatory skin models suggest that interleukin 23 plays a crucial role in the pathogenesis of psoriasis and help in differentiation into Th17 T cells, which produce interleukin 17 and interleukin 22. These cytokines seems to be pivotal inducers of epidermal hyperplasia, resulting in the abnormal maturation and epidermal differentiation in psoriasis. Psoriatic plaque shows a high level of vascular endothelial growth factor, which promotes angiogenesis and results in bleeding points when peeled off. That is called the Auspit sign. We are going to see this later. And this interleukin 8 has been shown to be responsible for the accumulation of neutrophils in the skin. Now coming to its histological changes, means what are the changes occurs in skin in psoriasis. Firstly, in the epidermis, there will be epidermal hyperproliferation with paraketosis, that is loss of differentiation of cells. And whereas in epidermis, the capillaries are dilated, twisted, and tortuous. Coming to its pathogenesis, according to Unani system of medicine, it includes different opinions from ancient Unani physicians. Unani medicine is based on the theory of humors. First, it was Hippocrates, who gave the concept of four humors, that is, dam, balgam, sapra, and soda, that forms the basis of health and disease. Along with this, there are six essential factors known as Asbab Zaruria, which includes Hawa Muhit, that is fresh air, Makul Mashroob, that is food and drink, Harkat Sukun Badania, that is body movements and repose, Harkat Sukun Nafsania, that is mental movement and repose, Naumo Yagza, sleep and wakefulness, and Ihtibas or Istifra, that is retention and evacuation. These are the six essential factors which, along with four humors in the body, maintains the health. Now, according to this concept, basic etiology of the Hashirul Jil described by the renowned Unani physicians is derangement in quality or quantity of body humors, mainly soda, that is black bile, inside the body, associated with rutubaterradia, that is morbid matter, and weakness of the skin. Now, this derangement of humors may occur due to some external causative factors, that is asbab badia, or some internal causative factors, asbab sabiha, which may act in combination or alone to cause the disease. Now we will see the different opinions of ancient Unani physicians about psoriasis. Firstly, according to Ibn Sina, this disease is caused by Khiltagartabai Sada, that is morbid melancholic humor, Rotobadaradia, Hirif, Laze, Mohtarif Khiltasada, and it occurs most commonly in winter. Whereas, according to Ibn Zuhar, he specified that it occurs due to accumulation of excessive amount of ghair tabai soda, that is abnormal melancholic humor in skin. Hence, the skin loses its power to remove this abnormal morbid material, resulting in skin tissues death and falling in the form of scales. Now, Ali ibn al-Abbas Majusi defined that it occurs when blood mixes with mirrah soda and balgamishur mirari, which are the abnormal humors. This physis express this acratogaliza waste wishes humors towards the skin from internal organs in order to remove it from body, but it remains underneath the skin. As a result, it destroys the skin and produces instant itching, roughness, and scaling, causing psoriasis. Now, according to Ibn Hubal Baghdadi, Welcome Malik, Ghalid disorder, morbid melancholic humor, fish burki mada, that is salty, irritant, and dry humors are the causes for psoriasis. Next, according to Ibn Rushd, he gave etiological concept of familial occurrence of Sadawi amras, that is melancholic diseases. He also mentioned excessive formation of vertebrae soda, moderate melancholic humor occurs in the body due to internal or external factors like diet, occupation, and abhorrence and environmental factor, and then spleen absorbs it. Finally, it mixes with the blood and produces the terrible disease that cannot be easily treated. And some more like Sabit ibn Qura, Nafis ibn Oskirmani, Dawood Antaki, Akbar Arzani Harshi ibn Qaf. According to them, Balgamishur Mirari, Safra Muhtarika, Ghalis Kiltesoda, and Ghalis Mutafin Zujadi Balgam, and Har Barid Diabis Qil, and Fasid Qil, and Hirif Azia and Sodavimada are the causes of psoriasis. Coming to the clinical features may include erythema, well-defined discoid-shaped lesions, scaling, itching, plaque formation, induration, and spillage of lesions in scalp psoriasis. Coming to the common sites affected are, you can see here the common sites. Now, coming to the types of psoriasis, there are three main types: chronic plaque psoriasis, gutted psoriasis, and pustular psoriasis. Now, this chronic plaque psoriasis, it is the most common form. It has an unpredictable cause of remissions and relapses. Its variants, according to morphology, are small plaque psoriasis and rheumatoid psoriasis. Smallpox psoriasis, it is smaller, that is 1 to 2 centimeter, and it resembles to guttate psoriasis. How it differs from guttate is that it occurs in old patients and it is more scaly and has a more chronic course. Whereas rheumatoid psoriasis, in this scales are pure conical and firmly adherent to underlying skin. And the CPP variants, that is chronic psoriasis variants, according to the site of onset, are the first the flexural psoriasis. As the name describes, it occurs on the flexural parts like groins, axilla, inflammatory folds, vulva, and gluteal cleft. Next is the scalp psoriasis, most commonly on the occiput. In the penile psoriasis, in uncircumcised males, the scaling is absent as usual one, unlike the usual one. Psoriasis of palms and soles. The scales are adherent to palms and soles, unlike loose scales at other sites. You can have the pictures here. Now, the guttate psoriasis, it occurs in children and adolescents, may be precipitated by streptococcal tonsillitis. Common size is trunk, clears within a few weeks by itself. In the pustular psoriasis, in chronic plaque psoriasis, when plaques are surmounted by pustules, it is called pustular psoriasis. It can be localized or generalized. Now, the clinical signs seen in psoriasis are Grates test, Auspit sign, Candle sign, Coibinus phenomena. In the Grates, you can have a video here. In the Grates test, in these scales of the psoriatic plaque can be accentuated with glass slide. Second, in a three-step test called Auspit sign, in which we gently scrape the lesion with a glass slide, scrape of all the lesions, a glistening white adherent membrane appears, called as Berkeley's membrane. On removing the membrane, punctate bleeding points become visible. This is positive Auspitz sign, generally not performed. Other than this, there is a candle grease sign in which the characteristic occurrence of scales can be seen as if one is scratching a wax candle. Also, there is a Coibinus phenomena. Actually, this is the occurrence of psoriasis on trauma site. Skin biopsy can be done to confirm the diagnosis. Coming to the diagnosis, diagnosis can be confirmed by clinical feature, can be done by clinical features like itching, scaling, and plaque formation, or else it can be confirmed by skin biopsy. Whereas Rubbs ball barrage, according to Unani concept, remains normal. Coming to differential diagnosis of psoriasis. Psoriasis can be differentiated from seborrheic dermatitis, discoid eczema, pityriasis rosea, candidal intertrigo by means of the lesions, the shape of lesions, scaling, induration, and spillage. Here, psoriasis has well-defined discoid annular lesions, unlike others you can see here, and it is indurated and erythematous, and there will be spillage of lesions, especially in scalp psoriasis. The lesions spillage to neck and forehead, and the scales in psoriasis are dry and silvery scales. Coming to determining psoriasis severity, the psoriasis area and severity index, that is PASI score, it is a quantitative rating score for measuring the severity of psoriatic lesions based on the area coverage and plaque appearance. You can have a look on this picture. Now, line of treatment. Uh, According to a conventional system of medicine, the topical agents may be used as emollient, coal tar, anthralin, that is ditranol, calcipotriol, routine can be used, and along with this corticosteroids. And in systemic agents, we can use methotrexate, acetyltrain, cyclosporin, vitamin D analogs, and retinoids. Lastly is the phototherapy, and photochemotherapy is the last option. Coming to usul ilaj, as per Unani concept of medicine, line of treatment in Unani can be izala sabab, that is elimination of the cause, evacuation of the fasid akhlaq, that is morbid matter, evacuation of the morbid matter, tertib mizaj, that is correction of temperament, musafiyadam, that is blood purification orally as well as locally, and the milahuru resolution, and the topical application of jali, that is detergent, muraqi, emollient, murattib, and muhalil, anti-inflammatory adwiya in the form of tira, that is jelly, zimad, ointment, and rogan, that is oil. Now we are going to see the management in Unani system of medicine. According to the principles and philosophy of Unani system of medicine, disease is a natural process. Its symptoms are the reactions of the body to the disease, and the chief function of the physician is just to aid the natural forces of the body. In Unani, there are three main types of treatment, such as Ilaj bil Ghiza, that is dietotherapy, Ilaj bil Tadbir, regimental therapy, and Ilaj bil Dawa, that is pharmacotherapy. In Ilaj bil Ghiza, under this, certain diseases are treated by the administration of specific diets or by regulating the quantity or quality of food depending on the nature of the disease. In psoriasis, patients are advised to avoid the intake of food that leads to increased production of soda bimada, that is black bile. Food restrictions are some salt, Sour and salt diets, alcohol consumption are advised to be restricted. Whereas food recommended in psoriasis are fresh milk, lamb meat, bottle gourd, cold and moist diet, kaddu, palak, mash, rogan, badam, chili, etc. can be advised. Next, coming to Ilaj with Tadbir or regimental therapy. In this, maintenance of general health is attained through modulation or modification in asbab zaruria, which we have seen earlier in the earlier slides. Some techniques or procedures are used to evacuate the morbid matter and correct the temperament of body. Advisable regimental therapies in psoriasis include first, venesection. It is a medical procedure in which the blood is withdrawn by puncturing the vein in order to remove excessive or abnormal humors. In psoriasis, basilic vein is advisable to do venesection. Next is the hijama or cupping. It is a form of local evacuation of humors to allow tissues to release and remove toxins through the surface of skin. Next is the hammam or Turkish bath is a type of therapy used to cause perspiration. It reduces the viscosity of humors and evacuate waste products through skin. And next is the tariq, that is diaphoresis. It is a process to speed up the secretions of sweat glands in order to excrete the waste matter. Next is Talih al-Alaq, leaching or hydrotherapy. It is a method of evacuation of bad humors with the help of leeches. Now coming to Ilaj with Dawa or pharmacotherapy, it is performed in two steps. One is a systemic therapy and topical therapy. Next is topical therapy. Systemic therapy includes tanqiya badan, that is evacuation of the morbid matter, and tartib badan, that is production of the fluids inside the body, tadil mizaj, that is moderation of the temperament, and tahleel aram and resolution, and tasfiyah dam, that is blood purification and resolution. And the next is the topical, in which gel, ointment, or oil can be used. Coming to evacuation of morbid matter, it is a process of evacuation of morbid matter of dominating humor, which is done next to nusd. Nusd is a process through which the consistency of the morbid matter is changed by the administration of munzijat, that is concoctives of respective humor, to make it easy to be evacuated from the body. Firstly, munzij with concoctive drugs given after the features of nusd are established in the respective humor. The istifrag of with the fasid akhlaq is done. This istifrag can be done through ishal, first talib, or hijama, in which ishal is the most common method of istifrag. Okay. Now, munzit muscle therapy. In this, Sautavi amras are the worst among all types of diseases, and it does not respond easily. The commonest mode of tanqiya badan in psoriasis is munzit muscle therapy, which is performed in three steps. First, use of munzijat soda, that is melancholic concoctives like that of Actimone, Galihul, Halilesia, Bisphage, etc. Then is a we use mucilus soda advia like Sapistan, Unab, Gawzaba, Turbutur and Jabeen Unab, and Ustakudus, Anjil, etc. can be used. After Munzij and muscle therapy, excessive yabusat, that is dryness, occurs in the body. To maintain the normal body function, tartib badan is advised. Okay. Now, Unani physicians advised Murattib Walazud Tilar, that is application of cold oils, and use of Maul whey, and ashjo for the production of fluids in the body. Now, moderation of temperament, that is Tadil Mizaj. It is important to correct the sway mizaj or imbalance of normal temperament to combat any disease. In psoriasis, it is achieved by hammam, that is steam bath, ghiza, diet, and rest. Next is the resolution and blood purification. According to the Unani system of medicine, skin diseases occurs due to accumulation of unwanted and waste metabolic products in blood. For this reason, drugs like Charita, Shatra, Unnab, Kamela, Postanin, Sandal, Haldi, Chop, Chini, Ushba, Mundi, etc. can be used. These are all the single blood purifiers of Unani system of medicine. Whereas in the compound formulation, we can use Machuninja, Chop, Chini, Drifel Shatra, Triyak Faruqi, and Sharbati Asli Soos. Next to the topical applications, we can use rogans like gandum, banafsha, rogan nilofar, rogan badam shiri, rogan khardel, rogan hindi, etc. And marham as marham ahmar and marham basilihun. With this, we have completed the topic on psoriasis. Hope you all got this. And I would like to thank Feminine Unani Medical Organization for providing a platform to share our knowledge. Stay safe, stay healthy. Thank you.